Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to Bristol Health Cares. I am your host, Kurt Barwis. I'm the president and CEO of Bristol Health. Today we have an exciting guest with us, Dr. O'Shea. He is an orthopedic surgeon and the head of our orthopedic program at Bristol Health. Welcome, Dr. O'Shea. How are you today?
Thanks, Kurt. Doing great.
Yeah. So tell us a little bit about yourself.
Well, I'm from Connecticut, but I left and I did my medical school in New Orleans and was in the Army for about 9 years. And that took me to Texas, where I practiced with a Baylor Scott and White organization for 26 years. And then a number of things happened, brought me back to Connecticut and saw this opportunity at Bristol Hospital. And it's been one of the best decisions I've made in my life.
I love that. I love that you said it's one of your best decisions you made. And actually, I think we would all echo the sentiment back to you is that we're so excited that you chose to be a part of our team and lead our team as well. So talk to me a little bit about the Army. So where were you in the Army? And
I did my training at Madigan Army Medical Center. That's where I did my orthopedics. After I was done with that, I went to Fort Hood in Texas. It's renamed, but I don't know the current name of Fort Hood. When I first got there, they sent me to Honduras for 3 months, which was actually a fascinating experience. I finished up my Army at Fort Hood in Texas, and that's why I ended up staying there with the Baylor Scott and White organization.
That's a big organization, right? I mean, that covers a pretty large geographic region of Texas, right?
Yeah. When I first joined them, it was just Scott and White, and they were kind of in central Texas, and they had some satellite clinics, and College Station was the biggest one. Then maybe about 6 years ago, they merged with Baylor. Baylor was twice as big, centered in Dallas. So it turned out to be a good fit for the organization.
Great organization.
Yeah.
And when you made that decision to come to Bristol and to come to Connecticut, it was around the beginning of the pandemic? I can't remember.
Yes. My wife and I had bought a house in Litchfield, and our master plan was to come up during the summer and go back and forth, and that was the first summer of COVID. So that whole plan was a disaster. And that's when my wife called me one day and said, there's a job at Bristol Hospital. So that led to me interviewing and then taking the job. So, but that's pretty much, COVID pretty much brought us to Connecticut.
Yeah. I kind of remember going through that and was really excited about the opportunity to have you join us and the fact that you would actually relocate from Texas to here. So it's really been great. So talk a little bit about, because the orthopedics program, like many in the country going through COVID, went through a lot of changes during the time that you first came until now, and has been quite extraordinarily expanded and really is a different program than when you started here. Through your leadership, it's just evolved so much.
Yeah. When I first got here, it was just Jeff Meter and I, and then we had one PA. And that's just because a bunch of people had left. And I think that was kind of some of the fallout from COVID and what came after COVID. But we've had the opportunity to hire some really great surgeons. We have Dr. Sorokin, who's our hand surgeon, and patients love her. She does a great job. She does a lot of complicated hand stuff and really good for the community.
Yeah.
Dr. Lavery is our sports guy. So he does a lot of sports knee and shoulder stuff, but he also does shoulder replacement, and he's also our best fracture surgeon. So if we get difficult fractures in, he's able to take care of a lot of that stuff. We got Dr. Brimel, who's our spine surgeon, and he's getting there. Spine's a little bit harder nut to crack to get the patients to come here, but he's also been doing some hip and knee replacement work and actually getting into the non-invasive hip approaches, which I think will help for the future. I've been pretty much doing mostly hip and knee replacement. However, with my experience, I'm pretty flexible, so I can do shoulder, I can do arthroscopic surgery, a lot of things, but the biggest calling right now is the joint replacement, and especially with our Mako technology, with the robotics, I think that's been a game changer, and it's been a lot of fun for me in my career to be able to do that stuff.
Yeah, it's really kind of interesting. I live in a neighborhood with in Bristol, and the true sign of somebody who's had joint replacement surgery is they're out walking around the neighborhood in the morning, and one of your patients I saw with a hat on, it was like the very first shortly after, they were doing really, really well, and I stopped and talked to them. It happened to be a surgeon at the hospital, and at one point in his life, and he was really pleased and excited with what you had done. So. And I see that a lot, to be honest with you. Maybe it's just me aging in a neighborhood it's also aging. So, but no, it's really exciting to, and again, I've had so many individuals that you've done that have had a second done with someone else, maybe with Dr. Rubens or something like that, have been thrilled because they had it done with the Mako robot and you guiding that technology. So really exciting. So talk a little bit about that, the advantages of having the technology versus, the way we used to do it.
Well, the traditional knee replacements or hip replacements were done with a lot of just kind of eyeballing it, or maybe using cutting blocks, and it's not all that scientific. It's not all that precise. What robotics does, and I'll just give you an example, when we're doing hip replacement, the hip's a ball and socket joint. That socket has to be tilted a certain amount to the front and up. And if it's important to get that very accurate, because if it's not, it can lead to dislocations and other complications. The Mako robot allows us to really put that cup in its precise position. And it also helps with other factors as far as how long your leg's going to be and offset, things like that. Same thing with the knee. The technology for the knee with Mako, we can actually do a much better job with alignment to make sure your knee's lined up perfectly, but also what's called ligament balance. So we can get the ligaments balanced prior to making any of the surgical cuts on the bone. So and the old way of doing it was you made all the cuts on the bone and then you tried to balance the ligaments. But sometimes, that's not the best way to do it. So I really think the Mako technology has been a game changer in joint replacement, and it also has a lot of safety features for it. So it's also, I think, a fairly minimally invasive procedure.
Yeah, it's and for a hospital like Bristol, I get this question all the time from people like, can you do what they do in these major centers in terms of technology, in terms of, getting the outcomes, being able to do the procedure? And it feels like in orthopedics, the answer is yes, a resounding yes, that I see so many people walking around that have had their joint surgery at our facility, And then there's others that I know have had it elsewhere, and our outcomes are extraordinary. I mean, it's just truly amazing what we can do.
Yeah, we're almost on the second. We're almost at 2 years since we got Mako. Prior to that, we had the ROSA robot, which just wasn't as accurate. But anyways, I think it's really helped, and I really enjoy it. You know, this is something I've been doing for 30 years.
Yeah.
So when I did conventional knee and hip replacement for 26 years, and then, you know, okay, now I'm going to use the robot. Initially, I was like resistant to it. I'm like, I don't need a robot, you know, but after I learned about it and, you know, did the courses and actually did the surgery, I think it's a great technology.
I'm laughing at myself because when I started in healthcare administration in Philly, we were building a new OR, and the first, so the chief of surgery said, in order for you to oversee this, you need to like spend a week in surgery and learn how it works and yada yada yada. So, my first case was a knee replacement, and I'm laughing because at the end of the case, or towards, you know, after they made all the cuts, the surgeon said to me, he put a string from up towards the shoulder down to the toe, and said, "Kurt, come over here and, you know, does this look straight to you?" And I was like thinking to myself, I had worked carpentry during the summers when I was going to college, and I was like, is this really what it's like? Because this isn't much different than me going and putting stuff together. But I mean, obviously a lot more complicated, but certainly it's very much evolved. And as I said, I know even one patient who had their second done, and you know, leg length or alignment, you can straighten a lot of those things out if the first one isn't done to the tolerance that is comfortable for the patient with the second one, and plan for that, right? It's really pretty exciting. So,
yeah.
You know, the other thing I think is really important for people to kind of understand is we don't just have the orthopedic surgeons. We have a physiatrist. We have a tremendous physical therapy and, you know, sports medicine complex, and then we have, you know, pain management as well, all in one place, which is the medical center. So, you know, maybe, and when a patient comes into that and is, you know, kind of gets into the system, I mean, it feels like the goal is to, as quickly as possible, get them to the right place, right?
Yeah.
So talk a little bit about that, if you would.
Yeah, and rheumatology too. You know, a lot of our patients come in for like a knee or hip replacement, but they have a rheumatologic disorder that affects all their joints. So it's nice to have the rheumatology department there with us, because they're sending us patients and they're taking care of our patients. We have great physician assistants that work in the clinic. The pain clinic's very important, the anesthesia pain clinic, because there's a lot of patients that either they don't need surgery or they're not healthy enough for surgery, but they need some pain relief. And they're very good at a lot of different techniques that they can use to relieve pain. Physiatrists, I think, are very important. Physiatrists can take care of a lot of people. Most people with back pain don't need surgery. You know, they need physical therapy. They might need some pain management. A physiatrist is a good person to guide all that stuff. So I think overall we have a great team. It's all in one spot. And our physical therapy department that takes care of a lot of our patients, they're downstairs.
Yeah.
And they do an exceptional job. So it's a great team approach.
Somehow when they were building that center and designing it, I didn't really pay enough attention to that physical therapy area. And then when I walked in it for the first time, I was like, this is like the best I've ever seen. I was really kind of taken back by the expansiveness of it, and really very state of the art, has everything there, and it's just an extraordinary place to kind of recover.
And you know, the physical therapists, they come upstairs and come talk to us about our patients. So, I mean, it's a good working environment. You know, they just come on up and we'll talk.
I love it because when I have a problem, I just go on down and talk to them. So it works out for me as well. But it is truly an extraordinary environment. And I think the other specialty is neurology too. And we have a neurologist that's going to be joining us soon, which really helps. But you're right. And the other thing I was thinking about when you talked about all the different, things that you kind of could go through, the other new wrinkle is waiting for an insurance approval. So you're waiting for an insurance approval or clearance, and you've got pain, and you can get some relief with pain management often to kind of, because sometimes they'll require that you do physical therapy for 3 months, or rule out all these other things. And it can be extraordinarily difficult. So talk to me a little bit about, what you think the future holds, for orthopedics. It seems like
Overall or for Bristol Hospital?
Well, both, I think.
Yeah. Well, for Bristol Hospital, I think the future looks great. We have 3 of our surgeons have been here, or 2 of them have been here less than 2 years. One has been here 2 years. I've been here 2.5 years, where I'm the old guy. But those 3 are the future of Bristol Orthopedics, and I think they're great. I'm going to be around for a while. I'm not going anywhere. I told Ed Henry.
So now we have that on tape right now.
There you go.
We have that recorded, so I'm going to hold that one to you.
Well, when I first came here, Ed Henry asked me that question. I said, well, I want to work for at least 10 years. So that was
That's
2.5
awesome.
years ago. So I enjoy what I do, so I've got no desire to retire at this point. I think the future, we're going to continue doing robotics, and I think, I hope that our joint program will continue to grow. We're adding another orthopedic surgeon next summer, and I have a feeling he's going to be doing a lot of different things. So there's a lot of positive. As far as the nation, we have an aging population, and we have problems with obesity, and joints wear out, and they really need our help. So I think the future of orthopedics is, it's a very needed specialty in our country and in our community.
Yeah, one of the things that's, since in my time at Bristol, that's happened is joint surgery has gone from being an inpatient case to an outpatient case, and I think that scares people. But is that changed? I mean, that was the initial reaction. Like, what do you mean I'm going to go home in a day?
Yeah. Well, I mean, that's the way insurance companies look at it, as an outpatient procedure. However, we have a lot of patients that live alone, so they can't go home by themselves. They got no support at home. We have most of our patients spend a night in the hospital. We do have people that are able to go home the same day, and the patients that have gone home the same day have all done fine. We also have some elderly folks, people in their 80s, maybe they have a lot of health issues, and they kind of would like to spend a night in the hospital and not go home right away. So we're not forcing people to go home the day of surgery, but we're trying to encourage them to do it if they can, because we have good home health that comes out to their house and can guide them through the recovery process and all that.
So, what I think is important, the important message there is, so people shouldn't be afraid that if there's a situation like you talked about, an individual who lives alone, for example, may not be a great candidate to go right home. But we work through that process with them. We really try to understand what their support structure is, what the environment in the house is, and are they going to be successful at going home before we make that decision, right? I mean,
Right.
And there's a lot that goes into that.
Yeah. And, there are some patients that make arrangements before the surgery so that they can go to a skilled nursing unit afterwards. And that helps a lot, because they'll spend the night in the hospital, but then they'll be off the next day. There are some patients, it doesn't happen too often, but something will go wrong. I've had 2 patients I've done hip replacements on that all of a sudden needed a pacemaker. But it actually worked out. They get the pacemaker the next day and then go home.
Yeah.
So, but there's always things like that can happen.
That's actually probably a good find.
Right.
Because, they're being monitored and everything else, and the fact that they need the pacemaker probably would have gone undetected if they had gone in. So that's really pretty interesting.
Right. Those are good things, good complications to have.
Yeah.
So.
So then I just kind of like, some of the questions I always get is like, people say, well, I want to go in and have both knees done at the same time. So bilateral knees. And so what's your thought about that?
I've actually, in my career, I've done a lot of bilateral knees, but I'm very selective about who I do it on because it's twice as difficult as having one done. I had one gentleman once say that he wanted to do both, and he was overweight. He wasn't in the best of health. He wasn't in good shape. And I said, I think we need to do one at a time. That gentleman, we did his surgery. He fell that night, busted his knee open. We had to take him back to the operating room to close it back up. He did fine. I saw him months later, and I looked at him. I said, "Now you know why I didn't do both your knees."
That's right. No, that's really an important message. And some people will do one and then wait like 6 weeks to 2 months to do the second, and that's even better yet, right? I mean,
I think it's better. I think it's overall healthy. I think your risk of complications goes up when you do both at the same time.
Yeah.
And that could be anything. It could be a heart attack, a stroke. I mean, any number of things, bad things can happen. The people I've done it in have generally been young, healthy people, Yeah. And, but I just, even these days, I kind of discourage it. I think just doing one at a time is probably best.
Yeah. Yeah. So then what's I always have this debate with my wife. It's like people that run all the time. Do they wear out those joints faster or do they make them healthier? That's a bizarre question.
That's a good question. I think it, in a lot of ways it comes down to the individual anatomy of the patient.
Yeah.
Because some people have poorly aligned knees. You see these people that are very bow-legged or knock-kneed or whatever. Those people are more prone to get arthritis because they're putting more force on one side of the joint. And some of it's genetics. So for some people, it probably is bad to run. But I think if you're running on a healthy knee, there's nothing wrong with that.
Yeah.
I have some people that have had, they've had surgery, they've had part of their meniscus removed. Maybe someone like that shouldn't be running because they don't have the healthiest knee.
Yeah, that's been great. So last thoughts about, our program, our physicians, our community, anything you want to tell the audience about us?
What I would say is that Bristol Orthopedics right now, I think is as best it's ever been. And I really think the future is just going to get better. And for me, it's been a lot of fun. When I left Scott and White in Texas, they were in great shape. And I felt like, okay, this is a good time to leave. I told my boss, I said, my job is done here. Of course, he said, no, it isn't. But I really felt like this was the next move in my life. And like I said earlier, I think it's been a great decision.
And we do too. So we're thrilled to have you. So for the audience, this is Bristol Health Cares. We love bringing these programs to you. We love being able to really cover important topics. If there's something you'd like us to cover, to bring somebody onto the program, please email us at cares@bristolhospital.org. I want to say a big thanks to Nutmeg TV for putting this program on, for producing it for us. Nutmeg is a great program, a community asset, and one that I think you all should support. So please engage with Nutmeg. You can go online and donate to them. But Nutmeg, thank you very much for all that you've done for us. Until the next time, this is Bristol Health Cares. Thank you very much. Have a wonderful day.